On this Wednesday. So great to have you with us.
And it's good to be with you all.
Finally Wednesday. Yesterday we thought it was Wednesday.
You thought it was Friday.
Yeah, I did.
We're almost there. That's why they call it Hump Day, because we're almost over the hump. All right, folks, let's take a look at a big number that we are watching. This is a beautiful story here.
Never too late to learn.
Yes. Well, Dr. Jen, we're looking at a sobering new study that's examining the racial inequities in healthcare.
Yeah.
Tell us about this.
So this was just published in JAMA, and it's really important before we get to these numbers to understand that we always have to dig deeper into statistics. We have to see how it affects different genders, different ages, different races, different ethnicities. That's what this study, also systemic bias, both in our population and in healthcare. This is something that when you identify an issue, that is the first step, and then you have to jump in and start to do something about it.
So what conversations should doctors be having to improve health care for Black Americans?
Well, I think we have to balance between a one-size-fits-all approach and then the patient we have in front of us and how are you at higher risk or lower risk, and then take steps appropriately. And so, according to these numbers, if you are Black in this country, you should probably be in a different medical health, public health risk category, and your healthcare provider should treat you appropriately based on that. That's the first step, and that's really important.
And extremely alarming.
Yeah,
for sure.
Thank you.
Really crazy.
Yep.
3 games away from the NBA final.
I mean, Faith, you didn't have anything else to talk about. You just had to bring up that
Wait,
loss.
she brought that subtle shade in her voice. No. DeMarco, I got you. I think it was the altitude.
Yes.
I think that they're going to do better in the next, because I would like to see a Lakers-Celtics.
Oh, that would
Sorry.
be classic.
No, that's historical. It's legendary, right?
Yeah, because some of us no longer have a dog in the fight.
Right. That's true.
All right, Faith, thank you. Even you know I love you.
I love you too. There's a whole lot more ahead right here on GMA3 on this Wednesday.
All right, folks, we're back now with Dr. Jan, and apparently there's a new study out that suggests that depression highs.
Yeah, and so we have to listen to these numbers. This was a Gallup poll. They found that in someone's lifetime, they had 29% adults likelihood of being diagnosed with depression. That's 1 in 3 of us. Highest rates were in people 18 to 44, and there was a difference men versus women. Women, 37% diagnosed with depression in their lifetime versus men, 20%.
Why so high?
You know, I think we don't know a specific answer to that, but I think typically, there's a saying in medicine, when you look for something, you're more likely to find it. So the good news in these kind of alarming statistics and rates is that we're looking for it more. We're asking about it more. We're studying it more. We're reporting on it more. And so when you do that, we shouldn't be surprised that we're going to find it more. But are there intrinsic differences between men and women? Probably. We're different on a cellular level. Every single cell in our bodies are different. So there's really not a surprise to me that there's a difference with respect to depression. But of course, as you guys know now, if you find a number like this, is what do you do about it?
Right, exactly. That's the question. What do you do about it?
Well, I think the first thing is awareness, not only in the healthcare field, but asking patients about it, but we should ask ourselves. We should be doing, as I like to say, a checkup from the neck up, just as we do with our physical health. And then we have to change our approach to mental health and wellness, and not only jump in when there's an issue or when we're struggling, but prevention. And that, I think we're starting to get on the right path with that. But we have a long road.
All right, Dr. Jen, thank you. We're back in a moment.